Well, Kriti, cardiac surgery is essentially four parts. The timing of surgery in congenital heart defects depends on the type of disease.
Right.
Some diseases need to be tackled within the first week of life.
Okay.
Some diseases would be tackled within even the first day of life.
Right.
I've been involved in cardiac surgery for almost 30 years now, and nowhere in my career have I seen advancement, technological advancement assisting a surgical specialist so much as I see it now. If you opt for a minimally invasive procedure, you are probably back to your office or work in 10 or 12 days.
Right.
Patients' relatives need to understand that patient feels very insecure.
I welcome all the viewers for joining us in yet another episode of RBH podcast HealthyYou. For today, our host Dr. Kriti joining in for interesting session which has been very close to everyone's heart. Yes, you guessed it right. This month as we celebrate the World Heart Day on 29th of September 24, the theme for this year is Use Heart for Action to motivate our society and people we care to come forward and help us in building a strong health awareness system wherein everyone has a right to access and prevent heart disease. Now, I would request to like to introduce our very first guest, Dr. Alok Mathur, Director, Department of CTVS, or as we know, cardiac surgeries. So, there is always an anxiety associated when we hear about surgery being advised to create an awareness about the advancement in cardiac surgeries, for example, bypass surgery, valve repair, minimal invasive techniques, how these interventions distinctively saves lives and adding to many more years. So I welcome Dr. Alok Mathur.
Hello.
Sir, to move on, just wanted to discuss on what are the surgeries which are being recommended to the chronic heart patients these days in India.
Well, Kriti, cardiac surgery is essentially four parts, which the most common and everybody realizes, the society understands is bypass surgery, what is called
Right,
traditionally, in which we fix the blocks in the arteries supplying blood to the heart itself.
right, sir.
It's called coronary artery bypass grafting. That's the first type of cardiac surgery that we routinely perform. The other are surgeries of the valves. The heart, human heart has four valves. The work of these valves is to permit flow of blood in a single direction. And sometimes, due to some diseases, these valves get affected. They don't function so well, and so we have to fix them surgically. We can either repair them or we can replace them with artificial valves. The third type of major surgery is what we call surgery for birth heart defects or congenital heart surgeries. Some hearts are defective from birth. These
Right.
are holes and there are obstructions to vessels going to the lungs or coming from the lungs. There's a whole spectrum of congenital heart
Right.
diseases which need surgical intervention as early as possible in most cases. The fourth group is what is evolving now and is called surgery of the aorta. Now, aorta, as you know, is the main artery coming out of the heart and taking blood to all other organs and parts of the body.
Right.
This gets affected, and that is now fast emerging as a subspecialty for surgical interventions and more so for endovascular interventions, in which we do procedures like endovascular repair of
Right,
aneurysms
sir.
and dissections of aorta.
True.
The last and the most important group now evolving is of the heart failure patients, in which we do procedures like ventricular assist devices and heart transplants.
Right.
That carries a lot of glamour to it. The surgery is a very complicated surgery. It is only permitted at destined centers who have adequate requirements to do
Right,
this
sir.
type of surgery.
So, sir, one common question from a viewer. So, just wanted to know how early for a newborn the surgery could be performed.
The timing of surgery in congenital heart defects depends on the type of disease.
Right.
Some diseases need to be tackled within the first week of life.
Okay.
Some diseases would be tackled within even the first day of life.
Right.
And so it's very difficult to generalize this
Mm-hmm.
that when it should be done,
Right.
but in most cases, the earlier the better.
Okay.
If the diagnosis is made, then the treating doctor would probably know what is the best time to undergo surgery for a particular type of disease.
Definitely, I agree with you, sir. Can you just tell us about the advancements that are being coming up in the cardiac surgeries, as people might be inquisitive to know about it?
It's a very exciting time for cardiac surgery, Kriti. I've been involved in cardiac surgery for almost 30 years
Right.
now, and nowhere in my career have I seen advancement, technological advancement, assisting a
Right.
surgical specialist so much as I see it now. If I want to summarize the major advancement for people, I think the most important advancement is now we have gone to minimally invasive cardiac surgery
Right.
in almost all subgroup of surgical
Right.
procedures. And so traditionally, we used to cut the sternum right in the middle of the chest to reach the heart. Now we approach the heart through in between the ribs on the right side or the left side. The advantages are that we don't cut any bone, and therefore the healing is very fast. The chances of infections are a little lower than what would happen if we were to cut a bone,
Right.
and the amount of pain and the recovery time have drastically come down. This is a very exciting field, and in India itself, a lot of centers are developing
Right.
programs which tackle all surgeries minimally invasive.
Okay.
The other major advancement has been the integration of endovascular techniques
Mm-hmm.
with surgical techniques. So now
Okay.
we have developed a hybrid team approach to
Mm-hmm.
many diseases of the aortas
Right.
and of valves
Mm-hmm.
in the heart, where a team of surgeon and the cardiologist they and a radiologist sort of sit together, analyze the problem, and
Right.
then kind of treat it with surgery, without surgery, or as a hybrid with some parts being done surgically and other being done in the cath lab
Right.
endovascularly.
Right. So you would suggest to go for minimal invasive technique, to opt for minimal invasive
Oh,
technique than the
absolutely. If it
conventional,
is
huh?
possible, the advantages are
Right.
huge. And for
Right.
the younger generation, especially,
Right.
the cosmetic advantages are incredible
Right.
because this wound right in the center of the chest is not a thing that you should, that
Opt
you
for.
lied or boast
Right.
or think. And so our small incisions on the side of the chest are practically hidden in whatever clothing you would like to
Right.
wear.
Right.
And
Very
so
true, sir.
cosmetic advantage is
Mhm.
huge.
So, any patient who has been advised for cardiac surgery undergoes with lots of fear, anxiety, trauma, be it mental, physical, emotional. So, how would you like gear up? How do you counsel them to overcome that anxiety and to go for the surgery?
Thank you for asking that question because we get patients who are so apprehensive of a cardiac surgery, and the relatives are overpoweringly apprehensive. And
Right.
so I would like to take this opportunity to tell everybody that we have to actually tone them down, and they'll be disappointed with this if they are planning to have a holiday, because the day after surgery we mobilize them, and before they go to out of the hospital they are taking a regular shower and they are walking up and down the stairs. And if you opt for a minimally invasive procedure, you are probably back to your office or work in 10 or 12 days.
Right.
And even if you don't and you have a regular operation, then also you are pretty much ready to go in 3 weeks time.
Right.
And so the our being a conservative society, and most of the information coming from sources that are not very accurate, I would say, and social media and stuff, I would like this opportunity to tell people that cardiac surgery has undergone a phenomenal change over the past
Right.
few years. The recovery and the medicines are very fast, and relatives actually have to get out of the way of patients
Very true.
recovering. So they are interfering by advising them that you need rest after cardiac
Very true.
surgery, whereas the doctor is telling them that heart needs mental rest and
Right.
physical exertion.
Very true.
So action for your heart, as the
Right.
theme
Theme
goes,
goes.
is very,
Right.
very
Very
true
true.
for cardiac
Huh.
surgery
Very
in this
true.
era.
So, as we see, for the average length of stay in our hospital, also, so that has reduced drastically over a period of years. So, looking forward for much more motivation for our patients to opt for the surgery. Coming on to the post surgical care and the rehabilitation, which they have to take care of after their discharge, if you would like to throw some light on it.
Yeah, and this is a constant struggle because
Right.
people around the patient and other people who have undergone cardiac surgical procedures are a constant source of advice about what to do and what not to do.
Right.
And so, my only message is that you need to physically start working in a graded pattern, which is explained by your doctor right from the day that you step out of the hospital. And even in the hospital, our regular exercises, trainings, and rehab programs start while the patient is in the hospital,
Right.
and they are sort of continued when they are at home.
Very true.
And more than physical rest, I think the patient needs to be mentally at peace, and mentally not burdened.
Right.
And it is a big burden. Patients' relatives need to understand that patient feels very insecure. He's insecure that he may do something which may harm his
Right.
surgery.
Very true.
And what he needs is more of a supportive role of relatives in adding to the rehab program, rather than a prohibitive role which is
Right.
followed by most relatives in India,
Very true.
advising him not to do physical
Very
activity.
true.
Even exercises that we advise our patients
Mhm.
are sort of used with a word of caution from the relatives. So we have excellent continuous rehab programs at our hospital, and I'm sure other hospitals have it too,
Right.
in which you have a graded exercise pattern to get you back to your feet and running within a few weeks.
So I hope our audiences believe in what our doctors say, and there is a validation point from their side too. So thank you, sir, for joining us for the session.
Thank you very much for the opportunity.